Hi, everyone. I'm Dr. Traci Moreno, and today in our therapist and training series, we are going to talk about progress notes. The most common progress note is called a SOAP note, and SOAP is an acronym, so let's go ahead and write that out. And I should tell you that this is also a common question in interviews. So this is something that you should know. It's probably the most common progress note used, although there are variations. So the S is for subjective. O is objective. A is assessment. And P is plan. So let's talk about what goes into each of these sections. S is easy. You're just going to state what the client talked about. What was the main topic of discussion? So there are different thoughts on this. So I come from a place of really trying to protect the client's confidentiality. So I make my subjective section pretty short in general. Like I will say, they discussed their history of childhood trauma. They discussed work-related stress. They discussed problems in their marriage, things like that. I try not to put too many specifics, but you also want to put enough for you for continuity of care so that when you go back, you can see what you last talked about and what you, and where you're, what you need to, what should be talked about next. So again, you can include quotes. Again, I think I've said this before in previous recordings that, with quotes, just make sure you're quoting exactly what the client said, and you're only quoting significant things that you wouldn't really it would be better for you not to say it. It would be better as a quote. Okay, so you're just going to put what was discussed. Okay, objective. This would include your mental status exam stuff, right? These are the objective assessment of the client in that session. And again, this is all in just that session. So you can also include their interview behavior. It's not an interview, but that's just common terminology to call it interview behavior. That's a common, just easy way to write behavior. So anything that's an objective assessment. So with assessment, this is your assessment of what's happening here. So you can assess, you can put their diagnosis, common way to write diagnosis. You can put any rule outs of diagnoses that you're thinking about that you kind of need more information for, especially, things that are a little bit more severe, like maybe BPD, borderline personality disorder, or maybe you're thinking there's ADHD there, or maybe there's a rule, you're trying to differentiate between something. So you would write it like this. That's how you write rule out, and then you would list the diagnoses that you're wanting to rule out. You could do ADHD and GAD. Sometimes with adults, the ADHD and generalized anxiety disorder often the symptoms look very similar. So you can also you want to put in here their response to the treatment intervention that you gave, right? So you definitely want to write your treatment intervention. So you're going to say, client responded. This could be well, adequately, fairly, poorly, something like that. Those would be the descriptors. Responded well to CBT and motivational interviewing, something like that. Or, whatever you used, you would list that here. So the important part here is what you used, what interventions you used, and how they responded. You also want to add their motivation for change. Motivation for change. Sorry about the writing. And their progress. So motivation for change, you could write they appeared motivated for change. They appeared Motivated for change, unmotivated for change. I sometimes say their motivation for change is questionable at this time, due to whatever. But you want to try to assess what their motivation for change is. Then you want to make a note on their progress. You could say there's a lack of progress, progress was made, progress unchanged, things like that. So that can be something simple. These are the basics that should go in the assessment section. But then you can also write any sort of assessments that you have of that. Well, they, maybe a reason why, like kind of your theory of why they might be unmotivated for change, or why they are not making progress, or you can add something about their coping skills, or it's something that they appear to have resistance or negative self-talk, or things like that that could be kind of causing the problems here. But as long as you at least put this as a minimum in the assessment section, you're good. Anything else, like your theories about what's going on, is additional. And that's also could be more for us, because we know where we're going with that client, what we need to work on, and that gives us that note to tell us. Plan, super easy. Plan is, what is the follow-up? So a lot of times the plan can be simply, you could put follow-up that way if you want to write it that way. Follow-up weekly, or 2 times a month, whatever the plan is. And then, so at a minimum, you need to just have the follow-up. It could be, that, and then you also want to put any recommendations. So if you made any referrals, it would go in the plan section. So you would say, referred to psychiatrist for, a psychotropic evaluation for psychotropic medication or something like that. You could say referred for couples therapy, family therapy, psychoeducation, anything that you advise them on, anything that you want them to practice. I add therapy homework in here. That's always a really good reminder for me too, because then on the next session, I want to start and say, like how did you do on that? Were you able to do that? It's always okay if they don't do therapy homework, that's on them. But, and you want to make sure that they know that, but you want to follow up and see. And if there was some resistance, you want to address that resistance. You want to say, why was it, why do you think that was difficult for you to get started, or what was the process like, and things like that. So that kind of gives you the next step for following into the next session. Okay, these are the basics of a SOAP note. Very, very important. Again, you might be asked this in an interview. So know it, memorize it, and practice it. All right, bye.